when a patient has epilepsy, they always have this doubt, why did this particular thing happen to me in first place? All these years I didn't have any epilepsy and all of a sudden this has just come there. What is the reason? And then the brain scan is normal sometimes, the EEG is normal sometimes, and again when everything is normal, why the epilepsy is happening? Again, this is the other question which the patient is going to ask us. Now let me tell you that epilepsy is a disease which happens because of a electrical disturbance in the brain. So what do I mean by that? Brain is an electrical organ. For example, kidneys are filtering organs. They'll filter your toxin and then make your body healthy. And then maybe the stomach and the intestines are the digesting organs. They'll just digest off whatever you eat and take out all the proteins and minerals and make the body healthy. That is how the digestive system works. Brain is an electrical organ. It creates electrical activity because of which we talk, we listen, we understand, we do all the activities. So since it's an electrical organ, supposing if there's an electrical discomfort, how do I say? Let's say when there is a transformer which is giving current to all the homes, when there is an electrical discomfort in the transformer, that is when there is a the transformer suddenly bursts or doesn't function for half an hour or it fuses, and after that, once again, when the electrical guy comes and fixes your transformer, the homes are getting the electrical current, isn't it? Like that, in the brain, where there is certain amount of electrical discomfort which can happen all of a sudden without reason, sometimes with reason. For example, let's say there's a bleeding in the brain or a clot in the brain or some tumor in the brain that can also irritate the brain and produce an electrical discomfort. Because of that, the patient can have a seizure. Okay, so electrical discomfort in the brain is the reason for all those epilepsy like activity. Okay, so this can be picked up using investigations like CT scan or MRI scan for the brain. We can do something called as electroencephalogram or the EEG, where we put the leads on the head and then record the brain activity. Like how ECG is done for the heart, we do the EEG for the brain. So this is the actual reasoning why epilepsy happens. Yes.